new data from the CDC, or Centers for Disease and Control, shows the health gap is widening for many who live in rural parts of the country.
15% of Americans living in rural areas were more likely to die early from one of the leading causes of death than people in an urban area. One of the biggest challenges, a growing physician shortage in rural counties. It's inspired a Kansas City University graduate to help. KSHP 41 News reporter Jian Kim sat down with her, who shared why this issue is so deeply personal.
Need your gown on. You'll need your hat.
Kansas City University's class of 2024 is checking off the last thing on their to-do list: graduate.
It is very surreal. It was a long process to get here.
In the crowd is Ann Ost. She's graduating with a doctorate in osteopathic medicine. It's been her dream to study and go back to her farming community in rural Kansas.
You know, here they are. They're feeding all of America, some of the world, you know what I mean? And who's there to care for them?
90% of counties in Kansas and Missouri are considered health provider shortage areas. In addition to the lack of resources, Ann says it's her mission to change the mentality many of her neighbors have. She lost her own father to COVID-19 after she says he waited too long to see a doctor.
There wasn't a lot of research into COVID, so I'm not sure that much could have been done at that point in time, but there are very real pathologies that can be prevented. And there is a very real category of people who just refuse to go in.
According to Dr. Richard Schooler, the economy, desire for the city, and lack of residency programs in rural areas all contribute to the shortage. That's why Kansas City University opened its Joplin campus.
Again, the intent is to keep those students there after they graduate.
He's also hopeful because there's momentum in federal legislation right now, and states are offering loan repayments for students who practice in small towns.
You didn't have to go into work. It's Thursday, right?
Students with ties to rural backgrounds like Ann are 2 to 3 times more likely to practice in small towns too. Ann and her mom Paula say the return on investment is endless.
They get connected with their patients quite well, so I think that you would be loved and well treated in a rural community.
It's very close to my heart because I think that these people genuinely are like the salt of the earth.
Jian Kim, KSHP 41 News.